Hello everybody, it's Dr. Galvin with our Corona update of the day. Today is Thursday the 18th, I believe. Did a little bit late today, sorry. Been very busy between the emergency department and here, lots of things changing. I'm gonna keep this one short today. US cases today hit 11,000. Remember, on the 11th of the month, we had 1,000 cases. On the 17th, we had 5,000 cases. That was 2 days ago. I guess today's the 19th. And today, 11,000 cases. So we're starting to follow that curve that we talked about, that exponential growth. I think it's really important that we take into mind all these recommendations. We've talked about social distancing, why it's important, and we're starting to see the increase in cases that we kind of expect. In Charlotte here, we've had our first case of community-acquired coronavirus. What does that mean? It means that we can't trace this person to anybody that's got a known travel contact or cruise ship or anything else. So it tells us that definitively it's in the community. Why are the numbers going up so quickly? Well, we talked about the logarithmic progression of epidemics, but also here in the US, it's a function of us increasing testing. The more we test, the more we're going to know who's got it. So we're going to see those numbers climb, and I've been telling you that for days, that we're going to see big increases. I think that Italy is, a week ahead of us, and what we're seeing out of there is really concerning. Today, I think they lost 475 people died yesterday, and they're getting 3,500 new cases a day, and that's with some pretty extreme quarantining now, with police not letting people even walk out of their houses. With a little bit of luck in the next few days, hopefully we'll see those numbers start plateauing as these things that they've implemented start having their effect. I think we need to talk about our millennials. We've seen the spring break photos, and I get it, 20-year-olds think they're invulnerable and immune, but the CDC came out with numbers today that shows that 29% of the patients that are admitted so far are between the ages of 20 and 44. So those kids are at risk, and we think that the amount of virus you get exposed to has some correlation with how severe it is. So if you're in spring break and you're around thousands of people and you're sharing, drinks and vapes and things like that, you may have the potential for getting a much higher exposure. So we really need to kind of counsel our teenagers and our young adults that they need to follow these guidelines. If we follow these things, we're going to protect ourselves and everybody else. I've gotten questions about elderberry. There's certainly no clinical evidence right now that elderberry has any effect on this virus at all. There's some anecdotal things that it may have an effect on immune function. It may well. There's also some people that are saying, well, don't use elderberry because it causes this cytokine storm. I don't think we really got good guidance on that. The information about not using Motrin, I think, is thin. I did a lot of reading on it yesterday. I'm not quite sure I buy it. I think the abundance of caution, if you get a fever, stick with Tylenol or aspirin. Remember, do not give your aspirin to kids, but if you're an adult, that's okay. And we'll update those guidelines as we go along. We had the first case that came out of the hospital where I work over the weekend, and so I think those numbers are going to go up. If you happen to have N95 masks, or you're in an industry that has it and you are closed, please understand that our supplies of these things are very low. And my colleagues, myself, my nurses, my techs, we're putting our lives on the line to take care of people, and we don't have the equipment. So if you happen to have it, or somebody that has a stockpile of it that you're willing to donate, please contact me. And we'll let you drop it off at the office if you're close. If you're not in this area and you're watching from someplace else, then call your local hospital. If you have any of these things at hand, they're not going to protect you at home. They're not doing anybody any good if they're sitting in a box in a hoard someplace. They need to be out where the people who are at the front lines can get them and use them to protect themselves and their families. Again, I'm going to update daily. It may be a little bit later. I'm trying to only provide new information if possible. I don't want you to worry. We've talked about this. The majority of people that are going to get this are not going to have really severe disease, but they can give it to other people. You got to wash your hands. I want you to protect yourselves, protect your families, protect everybody around you, and I'll be back tomorrow with more. Have a great night.